Talking with David Ashford, Minister for Social Care and Health, or Health and Social Care, let's put it the right way around. COVID-19 I want to talk to you about. I mean, I've just come back from my travels through Dubai, somewhere like that. Lots of people wearing masks. Here I get off the plane and you wouldn't know anything's up. And I mean, I know we're fairly safe and all that sort of thing, but you know, I think the ambulance were getting some sort of rehearsals the other day for this. The question is, what are you doing to be prepared?
So there is preventative measures in place. As you rightly say, there were drills run with the ambulance service as to how we would handle a case or a suspected case of coronavirus or COVID-19 as it now is across the island. The hospital's been having run-throughs as well in terms of how we would deal with isolation cases, serious isolation cases, and also we've been working with our UK partners how for them, if we got any serious cases, they would need to be airlifted or moved to the UK.
Are you going to start screening people at the airport, you know, with that thing?
Screening is not shown to be necessarily effective in the airports because don't forget there's an incubation period for this virus as well. I've got to emphasise again, it's low risk at the moment. Even with the cases that have emerged in the UK, the Chief Medical Officer, both in the England and also Public Health here, have actually got the risk as low moderate.
Should we all be going out and buying those mask things then?
Well, interesting thing, you see this whenever there's these sort of medical emergencies. My understanding is health-wise there's no proven effectiveness of the masks because this doesn't stay in the air long term, and if someone sneezes on you, if it's a fabric mask, don't forget it's going into the fabric. So my understanding is there's no medical grounds to show that masks work.
I mean, on the plane I bought some of those wipes and I had a hand gel. This is, my friends were telling me this is probably precautionary, just to think carefully what you're touching, isn't it, more than anything, and touching yourself afterwards? It's
exactly the same preventative measures as you take with flu or anything else. It's good hand hygiene and ensuring that if you are sneezing or you're spreading germs, catch them in a hanky, a disposable hanky, etc.
I mean, we're getting reports of Italy now having a major problem and shutting down there now. Do you see that? I mean, what precautions have you got? Have you got like that's the Cobra sort of situation here that you could isolate the Isle of Man or in some way if it really something all went wrong, you know?
We have emergency plans in place. I'm not going to speculate around what potentially can happen with it. As I say, the risk at the moment is assessed as low to moderate, and that's in the UK as well. We engage via our public health department with the public health department in the UK. There's the website off the main government website that's updated daily with the public health advice. So if anyone has any concerns or they want to know the latest advice, it is there for them.
And if you're coming back from one of these places, that could be Italy for instance now suddenly, do you self-report? Do you announce that you come from that region, or just wait for you to get the sniffles?
No, it is when symptoms present. If you've got the travel history and you have the symptoms, then we will undertake the relevant tests. We have, as I said in other interviews, had people with the travel history who've presented and we've done the tests. To date, all those tests have come back negative.
And they don't go to the hospital, they don't go to the doctors. You ring somebody, do you, to say there's a problem? Because that's the last thing you probably need is people turning to the hospital. Yeah,
the advice most definitely, and I cannot emphasise this enough, if you have that travel history and you are showing symptoms, you do not present to A&E and Nobles, you don't present to your GP, you either ring your GP or ring Meds, and they will then offer advice accordingly.
And we don't know where this is going because it's changing by the day, but a pandemic seems to be the way that the newspapers and the media are now reporting this. Do you feel that's potentially...
Well, it's not a pandemic at the moment. The World Health Organisation has made it quite clear it's not a pandemic. There's some wonderful headlines out there that I'm sure sell a lot of newspapers, but I think what we've got to be very sensible with is actually taking the medical advice that's out there, and in this case, the risk both in the UK and here on Ireland is still low to moderate, and it's very important that we don't start scare stories.
Because weirdly, flu itself sees a lot of people every year, and you say really the same precautions, it might actually help the whole situation long term. People that take more responsibility for keeping their hands disinfected and not coughing over people, that sort of thing.
Yeah, and it is important to get the message out there because, of course, the catch-all term that's been used until the name COVID-19 was given is coronavirus. Now, coronavirus is a catch-all medical term. It's not the specific name for this virus, so that does include things like flu, etc. And that's why, like I say, hand hygiene, the things that we should be doing day to day are exactly the same and crucial with this.
Finally, while I've got you, short term, the Chief Minister said you're taking over Bill Malarkey's ministry. Is that just a temporary thing? You're going to run both departments now?
Yeah, a department can't be without a minister, because in law, basically the minister is the department.
Right.
Obviously, I'm very sad to hear of Bill's passing. We were friends for many, many years, and the Chief Minister has asked me on a very temporary basis until a replacement can be appointed that I take on acting Minister for Home Affairs as well.
Okay, and he talked to me about that obviously there's going to be a reshuffle, not just that because David Cretney stood down, that sort of thing. Are you wanting to stay where you are?
Well, that will be entirely up to the Chief Minister.
To stay where
I am quite happy where I am at Health and Social Care. I have no intentions of moving unless the Chief Minister wishes me to do so, but time will tell, as with any reshuffle.